Thank you very much also for the openness to identify the challenges and how to want to tackle them. Now it's a turn to Frank Weichold from the United States. Frank, please.
I'm waiting for the slides to advance. Okay. All right. I pushed ahead and jumped over this very important slide, which is some illustration of the, if you want, diversity of the centers and the separation of the responsibilities. There are 7 regulating centers within FDA, and that's something to take in consideration if we think of coordination and orchestration. As such, specifically today, I'm just talking about mainly nanotechnology in drugs and devices, but many of the questions are very characteristic and have been pointed out already by my previous speakers about the challenges. As such, this is not necessarily new information. It is what the Center of Drug Evaluation and Research is facing up to. And certainly there are different characteristics of material that contains, or drugs that contain nanomaterial. And I'm not going to go through the challenges because, as you can imagine, as a clinical pharmacologist and a person concerned about safety, you make sure that the drug reaches the target. Compartmentalization and metabolism certainly plays a very important role. So those are challenges that we are all facing, and I think the inspiration to collaborate to develop methods that can be harmonized and standardized, and also to discuss opportunities where reagents and such methods can be exchanged and shared across the world, I think are very important steps forward to come to a platform where perhaps we, from a scientific point of view, first of all, look facts eye to eye and compare apples to apples. And certainly the regulation and the policy making, I think, is not far away from facing the same opportunity, I would say. Those are things that you're all familiar with. It's just to illustrate that there are different shapes and forms to be considered when we think of those drugs. So it's not that one bill fits all. And as such, I also would like to point out again that the FDA does not make special regulatory pathways for medicines or products that contain nanomaterial just because there is no reason for it, in my mind at least. And if we face challenges about new features, I think that's something to consider we have with any new technology or any other product. However, it's an opportunity to rethink our strategies, and I think we have a lot of work to do to shorten the time that it takes to bring a product to the market, and we have to think about the opportunities there. Similar, of course, medical devices use nanomaterials in different contexts, and as such the specific questions will differ to some extent. However, the end result of all this investigation is to understand that an agency needs to have the capacity, the scientific and the research capacity, to understand and analyze the products that it has to regulate. And for that, I would like to remind politicians and other members in the society that regulatory agencies have to invest into its research platform, and we have to build core infrastructure such as laboratories that actually can dissect the matter. Otherwise, we cannot enforce regulation. Again, those are elements to illustrate how the different products, of course, perhaps require a more specific question in one or the other direction, but it's not diverting from the principle that I just alluded. This is an example for CBER, and of course in the context of dealing with biologics there are a little bit other angles to the questions, but nevertheless. So let me talk a little bit about the orchestration within the agency. We have a nanotechnology task force. This was formed in the context of the National Nanotechnology Initiative, so it was a top-down organization, but if that would not have happened, I'm sure we would have formed a bottom-up coordination across the agency, because it is important that experts are linked together in a network, not just within one agency. But I think the reason we are sitting here, it has to happen nationally and internationally, because the world has become a global market. And just to give you one number that I remember, there are currently about 300 manufacturers internationally that FDA is dealing with when we think about the products that are imported. And as such, it's very much in our interest and any other regulatory agency to understand and coordinate and perhaps find ways to synergize, because resources are limited, and we have to think about this very carefully. This is more FDA specific. This is just a short reminder about the opportunities in a regulatory process, an application process, where the opportunities for interactions are. And that is to remind me to point out to you that it is very critical that you think of dialogue when you think of working with the agency and submitting drugs or products into the approval process. As you can see, there are different stages and opportunities, but I believe that the early meetings, the pre-IND meetings, are critical. And as a personal position and advice, I would say for those meetings, leave your lawyers at home. It is critical that the scientific challenges will be discussed, and that the climate of the discussion is collaborative, or at least in a format of a strategic alliance, because at the end it's always the end result depends on how the partners work together. So it's not just a one-sided coin. So this is just a list of things that typically occur at the FDA for the pre-approval process. Since the material is available, I'm not going to go through this point by point, also in the interest of time, so that we have more time for discussion and questions. We certainly have thought about how to speed up regulatory processes. There are some elements listed here, including the fast track, priority review, accelerated approval, and certainly breakthrough designation, which are all quite well defined if you look up the information material on the website, so I'm not going to delineate that. But it's critical to understand that we have to work together to address the risks or mitigate the risks, and in some ways shift it into the post-approval period during the time when the product is actually on the market. But of course, the challenge is that we currently don't have surveillance systems that are, in my mind, nimble enough and sensitive enough to detect critical signals early. And for that, again, there's an opportunity to work with the different stakeholders, to include even public media and public media data mining into what we call MedWatcher Social. We have a program specifically for that, to see how such method can be validated and included in the post-marketing surveillance. And in my mind, it's a very critical element to shorten the product development cycle time before something gets to the market. I would hope in the next 10 years into half, because I believe otherwise we cannot keep developing and bringing new drugs onto the market at a reasonable price. We are overwhelming the healthcare system with high prices for new products, and one of the reasons that we have the challenge with generics is it's an opportunity. 80% of American population is using generic drugs for the very reason that it is a less expensive approach. And yet with that we have a lot of challenges, and many speakers today have pointed out some of the challenges, at least in several of the presentations, which again is something that we shouldn't lose out of our mind. In the context of dialogue and interaction, this is a list of the opportunities to work in different advisory committees and how FDA seeks input. But I also would like to point out that in the context of the last year discussion, that we have enforced some of the international collaborations and enhanced the discussions. We have regular international regulators meetings on nanotechnology, which are actually not face-to-face meetings due to travel restrictions that we have in the government, and many people know what I'm talking about. So those are often phone conferences, and we will also have an open discussion as a result of one of the meetings tomorrow in the afternoon. Actually, it's from 11 o'clock as a open discussion looking at the progress that we have made across the international regulators in terms of the dialogue and the opportunities to harmonize.